AIDS, cancer, diabetes, we've all heard of these life-changing illnesses. Aside from the occasional fireman with a boot in his hand along the side of the road asking for donations, or the muscular dystrophy telethon, not many people have heard of or seen or even interacted with Duchenne muscular dystrophy. Duchenne muscular dystrophy is one of the most common genetic disorders for boys. Duchenne muscular dystrophy occurs once every 4,000 male births. In my speech, I'll cover the different causes, symptoms, and testing procedures. I'll also discuss recent medical developments, as well as new treatments available for patients. The first step in determining any illness or sickness is identifying the symptoms. Duchenne muscular dystrophy has many symptoms. Some of the earliest symptoms are apparent when noticed will be frequent falls, chronic fatigue, general muscle weakness, just overall inability to do things that a normal kid would do with their muscles. One of the first things we know from my oldest son Ian was his inability to run. Ian also missed several other milestones as he grew up. Duchenne muscular dystrophy is caused by a genetic mutation of the X chromosome, specifically the gene that deals with the creation and production of dystrophin protein. The disease can happen either spontaneously or most commonly passed from the mother to the kids. Less than 1% of kids with Duchenne muscular dystrophy are female. Most females are typically carriers and show little or few traits. After symptoms start to show up, several methods of testing for Duchenne muscular dystrophy are available. The most painful and quickest way to determine if a boy has Duchenne muscular dystrophy is a muscle biopsy. A muscle biopsy consists of cutting open a patient and cutting out a piece of the muscle. It's very painful, and one of the preferred methods of determining Duchenne muscular dystrophy. Typically, one of the first tests done is a simple blood test. In a simple blood test, you can get a count of the creatine kinase, also known as CK. This is also the first test Ian went through. Ian's CK levels were similar to that of a heart attack victim. After a heart attack happens, the muscles release different CK into the bloodstream. After having these tests done, several other illnesses were ruled out. We decided to draw more blood and go with genetic testing, which is also another way to determine if a boy has Duchenne muscular dystrophy. After 2.5 long months of waiting, Ian's test results came back positive for Duchenne muscular dystrophy. So having someone tell you that your kids have a severely life-altering and shortening disease threats you, you have to remain positive. Recent medical developments help kindle that ray of hope. A French neurologist first identified Duchenne muscular dystrophy in the 19th century, well over 200 years ago. In the last 200 years, many advancements and landmark discoveries have been made. And recently, as the mid-1980s, the strand of DNA that caused Duchenne muscular dystrophy was finally discovered. Since then, trial after trial has been attempted. Many failed, some succeeded. The most promising clinical trial as of late is PTC-124. PTC-124 is a trial that basically restores dystrophin, which is the protein that these Duchenne muscular dystrophy kids lack production of. PTC-124 first deals with um, the production of dystrophin in lab rats. Several high-profile cases have been started in the U.S. on human patients. In most cases, the restoration of dystrophin has been successful. The medical community has been experimenting with stem cells and exon skipping as well. Finding a cure is going to take some time. In the meantime, you have to prevent the development and onset of the disease with various treatments. Prior to the 1990s, life expectancy for a kid with DMD was only the mid-teens, typically around 15 to 17 years old. Thanks to various physical therapies, range of motion exercises, and adaptive equipment, the life expectancy has increased to the mid-20s. It's not uncommon or unheard of to hear of kids men even living into their 30s, maybe even their 40s. One of the most important treatments is orthosis. Orthosis is basically a cast of sorts that helps you with your heel cords or other body parts such as your elbows. It helps maintain your strength and helps you stretch them out. Different orthopedic equipment prolongs the ability to walk and use different body parts as well. Generally, kids with DMD lose the ability to walk between 10 and 12 years old. Adaptive equipment can extend this before the kid actually goes into a wheelchair permanently. Other adaptive equipment such as braces or walkers help extend the ability to walk as well. One of the most controversial treatments for Duchenne muscular dystrophy is the use of steroids. Some parents and doctors swear by it, some absolutely hate it because of all the side effects. Some doctors refuse to do it, others will let you do it at a very limited basis for a short period of time. But like any other drug, it has its pros and cons. The pros is should be obvious. You get a stronger kid who has the chance to walk longer and do other physical things that he typically wouldn't be able to do. For instance, my son Ian, he's now 6 years old. He's able to run. He was never able to run before. One of the obvious cons is you can get fat, you can get bigger, a lot of weight gain due to the steroid. Another one of the possibilities is brittle bones, but it comes with the territory and has pros and cons. Over the last few minutes, I've covered the symptoms, causes, ways to test for Duchenne muscular dystrophy. Some of the symptoms include general muscle weakness and genetic testing. I've given a brief history of the medical developments over the last couple hundred years, from the 19th century neurologist to diabetes today, former clinical trials. With any disease, you have to treat it properly with various therapies and medication. Parents never go against the gut feeling. My wife and I believe something wasn't quite right with Ian. After 3 years of tests and numerous doctor visits, we finally had a grim but correct diagnosis. Never take a second for granted with your kids.